Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. Tonight we have an important Wellness Wednesday conversation. We are focusing on your health and why having a primary care physician is essential. In the DMV, too many residents only see a doctor when they are already sick or facing an emergency. But medical experts say a primary care doctor should be your first line of defense. And that means helping you catch problems early, manage chronic conditions, and stay healthier longer. Our medical professionals will break down why primary care isn't just an option, it is a necessity. My guests are both from the University of Maryland Medical System Capital Region Health. Dr. Latay Bradford is a family medicine specialist, and Dr. Ricardo Fernandez is a specialist in internal medicine. Thank you both so much for joining this conversation. This is a very important conversation, and people really need to hear this. I want to first share just a couple of fast facts. More than 100 million people in the U.S. do not have a regular doctor for primary care. And findings show one of the key reasons is that there just aren't enough primary care providers in many areas, with the numbers of new doctors entering the field steadily decreasing. And about 25% of those without a primary care provider are children. And that is particularly important. And I do want to drill down on that a little bit later in the conversation. Dr. Bradford, let me start with you. You are a family medicine specialist. What is that? Let's just start with the basics.
That's right. And thank you so much, Harold, for having me today.
Sure thing.
This is such an important conversation, and it's my delight to be able to shed some light on primary care and family medicine. So family medicine physicians are primary care physicians who take care of, you guessed it, the whole family. So beginning at the very beginning stages of life, newborn care, all the way through the older ages, we call that geriatrics. Family physicians follow their patients over the course of the lifespan and all of the transitions in between. So if you have a family medicine physician, you could start with them as a child and continue your care. There would be no gaps in your care all the way through adulthood. And that includes even pregnancy care. So family medicine physicians do take care of pregnant persons. They deliver babies and then take care of mom in the postpartum period. So family medicine is a really special niche within medicine because of those longitudinal, those long-term relationships. We call that continuity of care across the lifespan and across all of the reproductive stages.
So, Dr. Fernandez, with that information, why would someone need an internal medicine expert as opposed to a family medicine specialist?
That's a good question. Thank you, Harold, for having me on.
Sure.
There's a lot of overlap in what we do. So a lot of internal medicine physicians also do general primary care. They focus on adults and not children, and they don't deliver babies. Some internal medicine physicians do adolescent care as well, maybe to about age 16 or so, but not all. So that's the main difference. There would be a focus on adult care as opposed to pregnant patients or pediatric patients. And then the other thing to know is that some internal medicine physicians focus entirely on hospital care and others do outpatient care.
That's interesting because I never knew that.
Mm-hmm.
Well, that's why you're here. But because I just assumed that internal medicine specialists addressed issues for everyone and all ages. So I didn't know that they really focused on just adults. So let's talk a little bit, if I can, about why someone really needs a primary care physician, Dr. Bradford, and obviously I touched on that in the intro. But from your perspective, talk to me about why primary care physicians are so critical to health.
I will answer that by starting with a very common analogy.
Okay.
So many of us have automobiles, we have cars or trucks that we use for transportation. And it would be hard to find anyone who does not get their oil changed, who does not take their car to be serviced on a regular basis. Why? Because once you have a problem, it's more expensive than the regular maintenance, right? So primary care is so important for health maintenance in the same way that you want to have regular checkups to ensure that your screenings are up to date. That means early detection of disease so that if something is caught early, it can be more likely to be treated and addressed without additional costs and long-term, health consequences. So we really focus in primary care on keeping people healthy. It's actually one of the joys of my job is to not address things after they've already been established, but to really stay on top of health maintenance and keeping people well.
Mm-hmm. Dr. Fernandez, that sounds like you can pay me now or you can pay me later, and not just with the financial responsibility that comes with good health care, but just health care alone. If it hurts a little now and you don't take care of it now, it's going to hurt a lot later.
Yes, the car analogy is a very good one. And unfortunately, there are people who don't take good care of their cars, in the same way they don't get the oil changed and tires rotated. But similarly, some people don't go to the doctor regularly and they wait until they have a problem. And then it can be sometimes more difficult or too late to do something about it.
Mm-hmm. I want to ask you a little bit more about the now versus later thing, Dr. Fernandez, because as we know, things happen. You could be feeling just fine, and we have seen, I would say, over the past 20 years or so, this rise in urgent care facilities. There is obviously a need for that. What kind of doctors are we seeing in these facilities, and what role do you believe those doctors play in perhaps taking the burden off of emergency rooms or even primary care? I mean, there is a market for that.
Yes, it's true. They can take some of the burden off of emergency rooms and primary care offices. I think from the standpoint of primary care, though, the physician or the provider does a better job when they know the patient and the patient knows them. There's trust. The recommendations can be better. There's follow-up and continuity, which don't necessarily happen with urgent care. So there may be a tendency to do too much testing, too much treatment that the patient may not need, and they may not get to the bottom of the issue as efficiently as a primary care doctor would if they know them. It's kind of like having a mechanic that knows your car, I guess, to continue that analogy.
Yeah, and I think that really is a good analogy. And as I said, even before we started this conversation, so I have a great primary care doctor.
Awesome.
He's great, and I can call the office. If something that wasn't hurting yesterday or last night that is hurting today, I can call in the morning and I can ask, look, I need to see the doctor, and I can get in. He doesn't work too far away, and I do have, as you were saying, Dr. Fernandez, a good relationship with him. So why do you suppose that so many people, even for those, let's say, who have insurance, let's just take some of those foundational obstacles off the table for this conversation. But if they have insurance, why don't they go?
to the doctor in general.
Exactly. Yeah, particularly their primary care to get the oil changed, to get
Uh-huh.
the to get those tires rotated, to get the tune up.
There's probably a lot of reasons. There's probably male-female differences in the way people think about healthcare. So men, especially younger men, tend to think of themselves as indestructible, healthy, and going to the doctor is maybe like a sign of weakness. So sometimes men might neglect their health, whereas women may be forced to go to the doctor for things like their children or their, childbirth, etc., more routine care. But some people don't have just the concept that you should go if you feel fine. Still, there are a lot of people who believe that you should just go when there's a problem.
Mm-hmm. Do you have those conversations, Dr. Bradford, with your patients?
Absolutely. And I have the fortune of having great relationships with patients who know how to reach me when, I don't have any appointment openings, but they know they can get in touch with me through their portal, the messaging system. I have established a way of being accessible and being able to address some of their more urgent needs, even if they can't physically come into the office to see me. So I can help identify what the problem is and help them triage. That means understand what issues can I address maybe with an appointment next week, what issues are a little more urgent where I may need to send you to the urgent care, or emergent issues that you should just go to the hospital. Some patients don't reach out because they don't think their doctor will answer. Some patients have prior experiences in doctor's offices, and I'm just going to be honest here, poor experiences in doctor's offices. And I don't think it's a poor reflection on the physicians. I think the system in which we're forced to work sometimes limits the time that we can spend with patients. And so some visits may feel a little bit rushed, and patients are like, I waited a month for a visit that's only 15 minutes, and so some people are turned off by that. And I just want to give voice to acknowledge that we as doctors understand that the system is not always conducive to the time that you need with your physician. But there are efforts to work around that. And I'm hoping that these kinds of conversations will just re-emphasize the fact that there are doctors, there are offices that are waiting and welcoming patients to come in before there's an issue.
Well, to that point, let us assume, Dr. Bradford, that there is nothing wrong, that nothing is hurting, that you don't feel ill, and you have an appointment that's coming up in a month. I mean, that seems to be a slam dunk as far as I'm thinking. Well, look, I need to have my yearly blood work or my physical, or something like that. That seems to be, an easy thing, and a month out, it can be conducive to one's schedule. So what, in your experience, what has been the reason or excuse for someone not coming to see, the wonderful Dr. Bradford or the wonderful Dr. Fernandez?
Some part of it, I would agree with Dr. Fernandez. There's this, invincible syndrome. Oh, I'm fine. That ache, I'll just deal with it. I don't want those medicines anyway. There's kind of a little bit of denial that there may be something going on. And even in the best case scenario, if there's nothing that you want to have addressed at the visit, it's just simply a checkup, then I think there's not the same fire, there's not the same incentive to prioritize yourself. Let's think about how busy people are with work and family and, all of the stressors of life. If you feel well, there's not the urgency, the incentive to have your regular checkup just to ensure that you are in good health. So I think there's just a mindset shift that needs to take place. There needs to be a little more understanding and incentive to prioritize your own wellness so that you can continue to be healthy.
Dr. Fernandez, I know you have some thoughts about that, but I will let you share your thoughts on the other side of the break. I did want to remind our listeners that you can hear this conversation as well as every edition of the Daily Drum Insight segment via podcast on our website, WHUR.com. The original Quiet Storm with Raheem Devon is coming up next on WHUR-FM. This Wellness Wednesday conversation continues on Sirius XM channel 141 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. We are continuing our Wellness Wednesday conversation about primary health care. My guests are both from the University of Maryland Medical System Capital Region Health. Dr. Latay Bradford is a family medicine specialist, and Dr. Ricardo Fernandez is a specialist in internal medicine. Dr. Fernandez, before the break, I was saying that I'm sure you had some thoughts about the reasons that you're hearing, or perhaps even excuses from your patients who do not come to see you as often as you believe they should.
Yeah, well, as Dr. Bradford mentioned, it's not always convenient. You know, people have busy lives. They may feel that there's nothing wrong, so why should I go and get a checkup? I think there's a lack of awareness among many people about what sort of screening tests are recommended. You know, just to check for cancer or precancerous conditions, to check for diabetes and high blood pressure, things that could affect your health that you may not have any symptoms. So that's a area where I think we could raise more awareness.
And one of the things, and I will say again from personal experience, and I think I've always been this way, and I saw this even with my parents when I was younger. And we go back to this wonderful analogy that Dr. Bradford meant, whether it's a Toyota or Lexus or anything in between, if you don't take care of yourself now, when you're feeling fine with your really busy lifestyle, that getting sick can get in the way of your really busy lifestyle. So my attitude has always been, I don't have time to be sick because I have too much to do. I have, people to see. I've got to go to the grocery store. I got to take care of my real cars. I've got to take care of my mother. I've got phone calls that I've got to make. I've got all of these things to do. And it is so much easier for me to plan the regularly scheduled self-maintenance so that I don't get sick. And allowing that to get in the way of my life, Dr. Bradford.
Yeah, you're right. That old adage, it sounds cliche, an ounce of prevention, taking a little bit of time now to prevent the illness is worth a pound of cure. And we're talking in currency of time, right? So taking a little time now saves you a lot of time treating chronic disease later. We're talking about the currency of money. So a little bit of money for prevention will save us a lot of money for treatment later. So in many ways, taking that time for maintenance up front and spending that copay up front really does save you on the back end. So, and just quality of life, let's say that too. You know, in terms of quality of life, just take the time to take care of yourself.
I have another question for both of you. I'll start with you, Dr. Fernandez, because while you're both here in Maryland, neither one of you are originally from here. So obviously you've done some moving. When people move around from city to city, state to state, how do you pick a doctor? It's one thing if you're in Maryland now, but then you get a job in Wisconsin where you're from originally, Dr. Fernandez. How do you go about picking an internal medicine specialist? What do you recommend?
Well, I think most people are looking at the list of providers on their insurance plan, or going by word of mouth or seeing what's around in the area that they can see, hospitals, clinics, etc. So I can't tell you that it's easy to find a primary care physician. There are not enough primary care physicians, particularly here in Prince George's County. And they don't all take all insurances, and they don't all have available appointments. So that's where I think a lot of people are forced to go to urgent care and places like that to get care when they need it, when it's convenient for them.
Yeah. Same question for you, Dr. Bradford. I mean, when you go to another city, is it like selecting a Michelin star restaurant? I mean, how is that done?
I will say, from what I've heard from new patients who come into my office, and even from a very personal experience, everyone is looking for quality care, right? So that word of mouth is really important. Yes, I agree that you should call the number on the back of your insurance card and ask for a list of in-network primary care providers, and filter that list based on who's convenient to get to. But then that word of mouth is probably even more golden, because when people can report positive experiences, having a doctor who listens to them, having a doctor who follows up on lab results, who shows empathy, all of those things almost transcend the medical care. Those soft skills almost outweigh the actual treatment plans. When people feel cared for, and you won't get that when you call the insurance line, right? You'll get that when you hear others' experiences. And so I would recommend, if you've moved into the DMV, you want to ask folks. Don't completely rely on those online reviews. They can be skewed. But
so
talk
no
to
Michelin
people.
stars for doctors. Okay, never mind.
There are grading scales, but I would say talk to folks and find someone who's recommended based on good experiences.
You said something that struck me. You talk about soft skills. This may be a little bit of inside baseball, but I think a lot of people who are listening to this conversation are probably wondering, so do they teach that in medical school?
Mm-hmm.
Do they teach bedside manner?
They do. They do. Being a physician is about so much more than medical knowledge. And especially this generation of trainees, they are hungry for something beyond being rote, robotic, paternalistic doctors. That means, they don't just want to be the person in the white coat pointing a finger and telling people what to do. I mean, this new generation of physicians are what we consider woke, right? Like, they are interested in social justice. They're interested in health equity. They're interested in providing quality care. And so I do think that medical schools are emphasizing a little bit more of those soft skills, the bedside manner, what happens not just in the exam room, but once the patient has left, panel management, all kinds of areas of medicine that go beyond just making a good assessment and plan. I do think that we're doing a better job of teaching that, but it's an ongoing learning process, and no one gets it perfect. We're human. We have good days. We have, not so good days. And I think all of us in our professions, whether we're in medicine or radio or otherwise, find ways to be the best version of ourselves every day.
Mm. Same question for you, Dr. Fernandez, about bedside manner and your medical education. Obviously, you've been a physician longer than Dr. Bradford, so you bring a unique perspective. How do you believe that for primary care physicians, bedside manner has evolved since you were in medical school?
Yeah, I agree with a lot of what Dr. Bradford said. I think medical schools are getting better and better at teaching those soft skills, how to interview a patient, how to talk to a patient, how to explain things to a patient. And hopefully physicians that are going into primary care are the ones that are more interested in having those kinds of long-term relationships with patients. So they may be more inclined to that kind of behavior. But it was a point of emphasis when I was teaching medical students. And I think, as I said, I think medical schools are focusing on that more and more.
You mentioned earlier that there aren't enough primary care doctors. From the outside looking in, I mean, you can just watch watch the news every spring, and you can see all of these doctors graduating from medical schools. There are stories about doctors getting their intern assignments. Is that what it's called? Or,
their residency.
Thank you so much. Like I said, my medical degree came from a Cracker Jack box, so what do I know? But when they're getting their their residency. So Dr. Fernandez, why do you believe there aren't enough primary care physicians? What is the barrier?
Yeah, very good question. It's kind of a complex issue, but I think some of it comes down to the money that you have to spend to go through medical school and the earning potential of specialty specialists. So specialists that do procedures or surgery earn a lot more than primary care physicians. Not saying that a physician still has a good income, but there's quite a difference. So people who have to pay off loans, sometimes they're thinking about that when they're looking at their career decisions. Also, primary care can be, there's a lot of pressure on us. There's a lot of time pressure. We have to see a lot of patients, partly because there's not enough of us, but partly because of the pressures of insurance payments and just numbers of patients that we have to take care of. So it can be a difficult job. You have to be dedicated. You have to like it. So I think the most dedicated people are the ones that go into primary care.
I think you make such an interesting point, because I know there are times when I've gone to see my primary care physician, and it could be a Monday, it could be a Friday, it could be a Thursday, whenever I need to address whatever's hurting. And yes, there have been times when you walk in and you're thinking, well, where are they selling the Beyonce tickets? Because the place is just packed with patients. And so I would agree that there are so many people who are going to see, whether it's a regularly scheduled appointment, or there's an ache, or there is a pain that that needs to be addressed. So with that said, Dr. Bradford, if what Dr. Fernandez says is true, why did you become a family practitioner instead of a specialist in surgery, OBGYN, geriatrics, something like that?
What Dr. Fernandez said is true. And I will also just add that there are some pressures even on students as they make selections for their residency training. There are some unfortunate pressures that even the faculty will suggest that maybe primary care is not the best option for you. And I experienced that as a student, where I was being encouraged to go into a specialty. And I'm so glad that I stuck to my heart and my passion. When you think about what used to be called general practitioners, or you think about, TV shows of the family doc for the town, that's the kind of medicine we want to practice. We want to have long-term relationships where we know people deeply, where we address not just their physical ailments, but we really take care of them with a full holistic scope of who they are as a person. Their religious and spiritual preferences, their, all of the factors that make them them. And it requires time to do that. But I knew that going into a private practice as a family doctor was not going to be the best fit for me. So I went into academic medicine. That means I'm a faculty member that teaches and trains residents and students how to be good doctors. I still see my own patients, but the pace is very different, and it does allow me to spend more time with my patients. So for those trainees that are interested in primary care, I tell them it's still possible to practice the good medicine that you fell in love with. You just have to find the right fit, the right position in order to, have the enjoyment and fulfillment that you went into family medicine and primary care.
It's interesting also, Dr. Fernandez, here in the DMV, this is a major metropolitan area with millions and millions of people. And one would think there's a doctor on every corner. But in other parts of the country, and both of you, I'm sure, are aware, you don't have to go very, very far to be in communities where there's one doctor. That's it. We're talking not even so much, suburbs or exurbs. I'm talking about those rural communities where you've got one doctor for an entire town, which is what Dr. Bradford was talking about. And so and even in the DMV, if you want to talk about the M or the V, you don't have to drive very, very far, where it may be a little difficult to find a doctor, Dr. Fernandez. And so, to Dr. Bradford's point, anyone going into, medical school, if they really want to serve the community and make communities healthier, that, Dr. Fernandez, it seems to me that would be something that they would have to consider.
Yes. It's true that in many places there's a difficulty in finding a primary care physician just because of availability. Prince George's County, for example, is very large.
Yeah.
Very geographically spread out. And so there are a lot of areas where there's not a close by primary care physician. But I think there's a recognition that there's not enough, that there needs to be more in the community. Some schools are beginning to pay attention to this and making efforts to produce more primary care physicians, and coming up with programs for students to try to encourage them to go into primary care. I think that's going to be increasingly important because it's sort of a crisis in our country right now. There's too many specialists and not enough primary care physicians. Partly because of the incentives built into our medical system, procedures and specialty care are very well reimbursed, and primary care is not as well reimbursed. But hopefully that will be changing.
I don't want to so much get into a I told you so conversation, but let's get into the I told you so conversation. And this is about health. Back to the important thing, when let's talk about men, Dr. Fernandez. So, Dr. Bradford, you can just put your hands over your ears for just a moment.
I see men too in my practice.
I know, exactly. And God bless you dealing with men. I'm one. But all jokes aside, Doctor, and I'll start with you, Dr. Fernandez. I'm sure you've been in situations where you've had patients where you've told them they need to make sure that they pay attention to X or Y, and they don't. And then it comes back to haunt them. Talk to me about that.
Well, certainly that does happen because everybody's situation is different. Their lives are different. They may be more or less ready to do certain things that you recommend. So you have to, that's where the relationship comes in, because you need to know what they're willing and able to do. Some physicians might be tempted to prescribe a treatment plan or a recommendation that is really not practical for the patient because they don't know them or they don't ask about their circumstances. However, if somebody fails to do something that I recommended, I don't think it's a good approach to tell them I told you so.
Hmm.
You want to meet them where they are. Certainly, if you try to make people feel bad, they're not going to want to come back to you necessarily. So ask them about, try to understand, like, what was it that led to them not doing that? Did they forget? Did they not know? Or did they just decide it wasn't important? And then go from there. There may be something that they're willing to do, but not other things. So you just try to make, I guess, progress toward better health.
Mm-hmm. Dr. Bradford, you can uncover your ears now. The but I like the way Dr. Fernandez said, you don't want to tell a patient, I told you so. And even from a personal perspective, you kind of, even if your doctor's not telling you I told you so, you can kind of figure out that you should have done what your doctor told you to do, so that this doesn't become a more severe problem. But have you had those same kind of experiences with patients where they didn't necessarily follow your advice and they ended up coming back for that same issue that you were reminding them about?
I sure have. And because of the relationship that I have with my patients, as soon as I walk into the room, they just say it all out. Dr. Bradford, I haven't done what you told me to do. Dr. Bradford, I've been, bad about my diet. They just come out and say it because they know there's going to be a no judgment zone. And we in primary care and in medicine, there's a term that we use called shared decision making. A lot of my treatment plans are a negotiation. So I'm telling the patient what I believe would be best for them, but then they're coming back and we're making a shared decision about what's the best treatment plan for X condition, right? And sometimes they'll say, Dr. Bradford, if you prescribe this medicine twice a day, I'm not going to take it. And then we take that option off the table and we find something else, right? So as Dr. Fernandez mentioned, you have to have a relationship with a doctor in order to have those honest conversations. It's only because my patients trust me to not shove down their throat, things that don't make sense for them, that we can come up with something that's actually feasible. And I also just want to give voice to the fact that the hard work of treating chronic conditions is not inside of the doctor's office. It's at home, right? The hard work of managing your health are all of the behaviors and the lifestyle habits that you've adopted. And that is so much harder than taking a pill, right? If we could fix hypertension and diabetes and all of these things just with pills, we would have cured it by now, right? But we can't, because it requires changing your lifestyle, which that's the hard part. So regular exercise and nutrition, but not just that, but good sleep patterns and stress reduction and, positive social connections. All of those things together are how we adequately treat chronic disease. And those are hard things to continue to do consistently.
If I can piggyback on that, Dr. Bradford, since you've been practicing in Prince George's County, what are the issues that you have seen the most? And let's just not I want to talk about in adults, not the children.
Sure.
But what are the issues with men and women, those who are over 18 all the way up to 60, 65, what have you?
Well, this is a very convenient time to mention that November is Diabetes Awareness Month. And so I will start with that as one of the most common chronic conditions in adults, not just here in Prince George's County, but in the United States abroad. But diabetes type 2, we'll focus on that. So there's two different types of diabetes. Diabetes type 2 generally forms later in life in adulthood. Unfortunately, we are making new diagnoses in adolescence just because of the lifestyles and the epidemic of childhood obesity. But Type 2 diabetes is the body's inability to process glucose. So it can't take glucose out of the bloodstream. And so left in the bloodstream for a long period of time, it actually becomes a toxin to various parts of the body. So it attacks your nerves and you get what we call neuropathy. It attacks your kidneys, literally every part of your body that you can think of, that extra sugar in the blood. And so we manage type 2 diabetes with a variety of medications. Some are oral, some are injections. But I can't emphasize enough the lifestyle piece. You can be well managed with a diagnosis of type 2 diabetes if, one, we make the diagnosis early, and that's why those screening labs are so important. Those annual labs, just to check in on things, to catch the pre-diabetes before it becomes full-blown diabetes. We have an intervention called the Diabetes Prevention Program. It's an intensive program. All you need is a referral from your doctor. But when we identify you're in that pre-diabetes zone, it's kind of like the warning flag. We can get you into an intensive program to reverse that process so that you don't experience those long-term complications of diabetes. Mm-hmm. So diabetes, I just want to emphasize, because it leads to so much morbidity.
Yeah. Dr. Fernandez, you were going to say something.
Oh, yes. I agree with everything Dr. Bradford said about diabetes. It's very important, very prevalent in our community. High blood pressure, hypertension is another major risk factor for heart attacks, strokes, and congestive heart failure, of which we see a lot in our hospital. So we see a lot of people with these kind of end-stage consequences of these conditions, also end-stage renal disease or dialysis, amputations of limbs. And many of these things could have been prevented if the disease or condition had been identified earlier and treated adequately. So that's where I think we could do a lot better.
Yeah, I think that is a great place to end this particular conversation. But I really appreciate both of you, Dr. Bradford, Dr. Fernandez. Look, listen to your doctor. You know, get the oil changed, get the tune-up, right, get those tires, you know, rotated. And if your doctor says, you know, get on the metaphorical racetrack and walk around a little bit, you know. But yeah, I wholeheartedly agree. And you know, do what you need to do to stay healthy now, so that you don't have to have severe problems. Again, thank you both so very much. I really appreciate you talking to us. Great advice, and we will certainly be in touch.
Thank you so much.
Thanks for having us.
That is the Daily Drum for this Wellness Wednesday conversation, November 12th. I'm Harold Fisher.